Hi, this is Mark, and this is my prostate cancer experience. I'm coming to you today, 14 days after my surgery. I'm back in Miami. I flew to New York to have the surgery with Dr. David Samadi, and now 14 days later, I'm back home. And I just wanted to bring you up to date on what the experience has been so far, post-surgery, traveling home, post-catheter removal, all these sorts of things, just so you can get a bit of a glimpse into what my life has been like for the last 14 days. The good news is it's 14 days later and there is no cancer left in my system. So the pathology report came back and there were three areas of the prostate with a Gleason score of 7. The entire prostate was removed, and along with it all the cancer. So I'm absolutely over the moon over that. Life is good, life is getting back to normal, and I'm delighted. On top of that, I want to talk about the state of my body right now and where things are at. So I opted to stay with the catheter about 12 days after surgery. Typically you'll have it removed after 7 days, but we tried that and we decided that I would go a little bit longer. So today is Sunday, and on Friday I went to Dr. Samadi's office, had the catheter removed, and it's been pure heaven ever since. I'm delighted to report that I have 100% continence, meaning sometimes when the catheter is removed, there's a little bit of leakage, a little bit of difficulty controlling urine flow, but I'm 100% spot on, and I'm delighted about that. Part of the reason for this, Dr. Samadi has a procedure for removing the prostate that he developed, and he calls it the SMART system. But the best way to really describe it is the typical procedure for surgeons when they remove the prostate is they get in there, they remove a lot of the nerves and tissue around the prostate, they remove it, and then they fix things up so the plumbing works again. The bladder then is connected to the urethra and it flows. What Dr. Samadi does differently is rather than remove these areas around the prostate, he pulls the prostate away from those nerves and areas, and the result of that basically is a much cleaner, much more effective removal, and it gives them the ability to get things back to normal as quickly as possible. So that's something that's very unique to this particular surgeon, and I'm the beneficiary of that. I did on Saturday, so the day after the day after my catheter was removed, I did hop on a plane and fly back down to Miami, and I was a little concerned. I wasn't sure if there would be any type of strange reactions, but it was just fine. So right now I'm feeling great. I'm sleeping well. I really don't have a lot of soreness. There's a little bit of leftover soreness from the work that was done internally, but it's nothing you can't live without. My energy is 100%. There's going to be a natural tendency to want to go out and do things, but I'm still going to take it pretty easy for about 4 weeks. My job as a real estate broker doesn't require a lot of heavy lifting as a general rule. So I can go about my business, working a little bit from home, visiting the office, doing a lot of phone time, computer time, etc. So that should work pretty well. But I just wanted to bring you up to date. If you're a prospective prostate cancer patient, meaning you've been diagnosed with prostate cancer and you're looking at your surgery options, and if you're young and if you're healthy, I would definitely say that the prostatectomy is the way to go. Don't feel that losing your prostate is going to be a life-changing event. It really isn't. I feel like I always have felt, and life goes on. Life is great at this point. I'm very, very lucky because, as I said, I have full continence, but I did a lot of preparation for that, which I think helped in the process. One of the things that I did is I spent about 6 weeks with a personal trainer prior to the surgery, making sure that my core, my internal system was in great shape and well tuned for this. The other thing that I did is about a month before surgery, I started Kegel exercises, which is really just a clenching of the inside of your body, and there's a lot of instructions on how to do it, but I would do about 10 sets of these 10 times a day for about 10 seconds, and I think it really, really helped. Post-surgery recovery was just, a real dream after that. So that's it. 14 days later, and I'm glad to be back here. You know, New York will always have a special place in my heart because it's the city where I became cancer-free, and absolutely due to the efforts of Dr. David Samadi, his amazing facility at the Lenox Hill Hospital, and a great support team. I felt like a king the whole time. All the support staff was there to answer any questions and to really make me feel comfortable. I am going to post a separate video that talks about, after the catheter has been removed, what urination is like and what the experience is. It's a little different than what you're used to, but frankly, I'm fine with it, and in some respects, it's an easier way of doing things. So look for that video as well. And in the meantime, keep an eye on this series on YouTube. This YouTube channel will be updated at this point, probably in another 4 weeks when I have my 6-week update. We also will be monitoring my PSA for many weeks, months, and years to come. The expectation is that the PSA should stay at 0. For the most part, meaning that the cancer is indeed gone. I have no expectation for it to return whatsoever, but it can't hurt to be a little on the proactive side. So keep watching the series. If you have any questions, if you want to talk to me directly, my contact information is in my YouTube channel. But life is good, and this is not an experience that you're not going to be able to live without. And frankly, I've probably never been happier in my life, having gone through this and having gone through it so seamlessly and effortlessly. It didn't have its share of, you know, there were difficulties along the road, nothing you can't manage. It toughens you up a little bit, but look at me now, and I feel great. So the incisions are minimal, they will all disappear, and I can't say more enough about it. So that's it for now. See you later.